This portion of Lee Pitts Live is brought to you by Hodges University, educating the leaders of our community for over 20 years.
You will love his wit and smile when he shares his charm with you. He's got a star that can't be denied on Lee Pitts Live. Come on and listen. You will enjoy and learn if you're wise. There's talking and singing. Everything is there to keep you swinging. We're glad you tuned in to Lee Pitts Live.
Welcome back, Southwest Florida. I like the live format of Lee Pitts Live because sometimes you guys may catch me in the middle of talking to my fine guests. And I got a great guest here, Dr. Khan. Dr. Khan, welcome to Lee Pitts Live, my friend.
Honor, pleasure to be here.
Good. You are, let's just call you the sleep guru for right now.
Okay.
The process of getting proper sleep, we take that for granted, don't we?
We do.
What are some common things that people think about sleep in terms of the way they approach sleep that they should start rectifying right now?
Okay. There's things that, like you mentioned, that we take for granted. So one of the things is habits that we've developed over time. Those habits can be years in the making. So one of those things is both you and I are workaholics. So things in bed that we shouldn't be doing. Reading our papers for the day before, watching TV.
Laptop.
Laptop.
That's me, man.
On the computer, texting.
Mm-hmm.
So all those things keep you from getting a good night's sleep.
Really?
Yeah, the other thing is taking my Leap Cup mug and drinking a cup of coffee. Close to
Bedtime.
bedtime, right. So that prevents you from going to sleep at night. A soda, at 6 o'clock in the evening will prevent you from sleeping at 8 or 10 o'clock at night.
What do you say to those people like myself who says that if I go to sleep, I can't regiment my life to go to sleep every night at 9 o'clock and get my 8 hours? What do you say to people like me?
Well, they're habits that you've developed, and it's a matter of discipline so that you do the same thing over and over again. And if you establish that, then it's easier for you to fall asleep at night.
Could that be contributing to me having these little extra pounds now?
It does. Sleep is something that, if you think about it, should be 7 to 8 hours per night.
Okay.
So that's 25 to 33% of our lives should be spent sleeping. So if that is not enough, if it's insufficient, then it affects you from head to toe. And weight is one of the things that gets affected by not sleeping properly.
Not sleeping enough?
Right.
Okay. Sleep disorder, what is it?
They're a group of medical disorders that prevent you from getting a good night's sleep. So you can break it down into different ways. So one aspect is things that help you go to sleep at night. So that's insomnia, and that can be a day, a week, a year, things that we talked about with the caffeine and work. And then there's other issues that keep you from sleeping at night. So you fall asleep at night, and then you're waking up constantly during the night. So that's other medical disorders. So heartburn, for instance. You eat like a spicy sandwich at night, and now you're up during the night. Heart failure, arrhythmias, so now you're short of breath at night. And then the most common thing that we see in clinic is not breathing properly while sleeping, and that's sleep apnea. It can be as mild as just snoring, something which is even less severe than snoring, which is called airflow limitation, or you can actually have big pauses in your breathing while you sleep. By definition, those pauses are 10 seconds, but they can be as long as 45, over a minute in length.
How does snoring play into all of this?
It's snoring, it's that when you breathe, the airflow should be smooth. So snoring is basically turbulent airflow. So when you're snoring, it can be mild, so it's only disrupting the person sleeping next to you or your kids in the other room.
Is snoring a bad thing? In other words, are you sick? You got a sleep disorder problem because you snore?
It can be. There's a higher incidence of heart disease with snoring. Patients that snore have a higher plaque burden in their neck, so that predisposes them to stroke, memory problems, so it can be a problem.
When you go about diagnosing somebody that's having a sleep disorder? What's that process?
So the first thing is come into clinic. And a lot of this is just spending some time with the patient and talking to them. It's a series of questions that we ask. It's spending half an hour, 45 minutes, just asking them questions and seeing what their normal routine is and what their symptoms are. After you go through that process, we do have some testing available. And one of the big tests is a sleep study. So basically what that means is you would come into one of our sleep labs and you would spend the night or day with us depending on when you normally sleep. And we would just measure a whole bunch of parameters.
Not to elaborate on it too long, but I had a sleep study done to me. I really enjoyed it. It was very educational. Afterwards, I got a chance to look at some readings that they showed me, and they hooked me up with all this equipment. And you know, fortunately, I didn't have a sleep disorder problem.
Good.
What do you say to the average person who thinks they may want to take that test and they shouldn't keep thinking about it, they should go do it?
Well, the first thing is speak to a specialist who knows the proper indication for the test.
Like yourself.
Right, exactly. If you can't sleep, then I don't really want to do a sleep test because you'll be spending the night with me and you'll be awake the whole time, right? That's the first step. And then after we go through the history and speaking, we can determine if that's really something that you need.
Is this sleep disorder something that only occurs with adults?
It's not. There's different things which are more common in kids and other things which are more common in adults. So for kids, for instance, they have issues which are called parasomnias, like sleepwalking, sleep talking, bedwetting. It's normal up until a certain age, but after you pass that age, then it becomes a different problem.
How do you go about diagnosing a child, and what do you do when it's a child, let's say a 3-year-old or something like that?
Sure. So children, the good thing about children is that they're brutally honest. So never ask a child what color your teeth are because they're always going to say yellow, right? But they display things differently than adults do.
Okay.
So kids tend to act out and they get rowdy, and then they get labeled as a problem child or bad parenting, when in fact it's issues with their sleep. Common things about children are they just don't get enough sleep. A 3-year-old should be getting 12 hours of sleep.
12?
12.
Woo, my little boy. He's not doing what he's supposed to do.
Yeah, no, a 10-year-old should be getting 10 hours of sleep. And if they don't get that sleep, then they're not functioning well in school. They get misdiagnosed with ADHD. They don't do well. They do poorly, not getting A's and B's like they should.
Well, he's not doing what he's supposed to do. That's my fault. We are not doing to him what he's supposed to be getting done to him. We're supposed to be telling him what to do, right?
Well, that parenting is important.
And he wants to stay up and watch Batman. Okay, now can a sleep disorder be cured or just managed?
It can be cured. Think of it as high blood pressure or diabetes. Those issues, if you take one medicine or 2 medicines, they get better. The first thing a doctor is going to tell you about high blood pressure is diet and exercise. So that's the cornerstone of sleep disorder, sleep apnea. And if you can successfully do that, then it can be cured. Otherwise, there are other treatment options that you have to take.
Excellent. Dr. Khan, give a phone number. We have your website on the screen. Let's give a phone number where people can reach you for more detail.
239-343-0762.
One more time.
239-343-0762.
See that? That's a plug for you. If you think anything resembling a sleep disorder or anything like that, just give Dr. Khan a call. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like Dr. Khan and all the fine people at Lee Memorial Health System who are doing it. We'll be right back. Keep it locked.